day, everyone. I am Kurt Abuscado from Our Lady of Fatima University. So now we will be doing giving a patient a hot compress. So first, I will be reviewing the client's chart for medical history and contraindication for hot therapy, and also reviewing the physician's order, the type of heat application, treatment site, duration, and temperature prescribed. Now, next is I will be bringing the necessary equipments needed for this procedure. So as you can see, these are the equipments needed for this procedure. So now I will be identifying the patient. So good day, ma'am. I am student nurse for today. I am Miss Kurt. So may I know what is your name?
Christine Mandrada po.
When is your birthday, ma'am?
June 6 po, 2007.
Okay, ma'am. May I see your ID band so that I can
Yes.
verify you? So now I will be closing the door and the windows for to provide privacy to the patient. Then now I will be explaining the procedure to the patient and the purpose of this procedure. So now, ma'am, I will be doing or I will be giving you a hot compress to give the affected area a adequate blood flow, reduce pain, and promote healing. So, do you have any question, ma'am, before we proceed? So, you can ask question naman po during the procedure. So, okay. And now, I will be assessing the client's skin, specifically the area to be treated, and also I will be inspecting the client temperature, pain sensitivity, and also I will be inspecting the area if there's any wounds. So, permission to touch you. So, ma'am, in the scale of 0 to 10, 0 is being the no pain and 10 is being the worst pain. Can you rate your pain sensitivity to the
3 out
hot?
of 10.
There's no any wounds naman or any discoloration in the skin. So, next is now position the bed. Usually, bed elbows height of the caregiver. So I already adjust the bed and position the patient in comfortable position. And now, next is I will be performing a hand hygiene and putting my clean gloves. And then next is I will be placing the towel under the area. Permission to touch. Taas ko lang po. And then next is now I will be applying the hot compress. So now I will be filling the hot compress in hot water. Then the water it should be 46 to 52 degrees for conscious patient. Then I will be putting this para hindi mabigla si patient sa temperature. then next is if the patient reports any discomfort, stop the application immediately. And then after that, if after 15 to 20 minutes or if the physician prescribed to remove the hot compress, you can now remove and inspect the part uh, you apply if it is effective. How will you? Then now remove the towels. And then position the patient in comfortable position. And then evaluate the patient about the procedure. So, ma'am, after the now the procedure is ended, how do you feel, ma'am?
Ayos na din.
So, okay po, thank you for cooperating for this procedure. Just ring the bell po if kailangan po kayo so that I can be para agad po magpupunta po kayo. Thank you po. And then now, remove the gloves and perform a hand hygiene. And then document the findings. After giving patient a hot compress, now I will be giving patient a cold compress. So first, I will be reviewing the patient chart for medical history and contraindication for cold therapy, and also reviewing the physician's order in cold compress, including the treatment site, duration, and frequency. And then I will be assemble next the equipments. As you can see, here's the equipments needed for this procedure. It's already assembled. And then next is I will be explaining the procedure to the patient. So, hello ma'am. Now I will be giving you a cold compress to your affected area. So, to relieve your pain, inflammation, swelling, and any bleeding if there kung meron na pong bleeding sa affected area niyo. So, you may feel cold first, then next is burning, aching, and finally, numbness. So, do you have any question, ma'am, before we proceed?
Right then.
Okay, ma'am. So, thank you. So, next is, now I will be assessing for the patient's skin. Permission to touch it.
Yeah.
So, inspect for the skin condition, any wounds present in the patient affected area. So there's no. And then next is perform a hand hygiene and put clean gloves. Then now I will be placing the towels on the patient affected. And then next is you can now apply the cold compress to the affected area. Applying a cold compress, it takes 15 to 20 minutes. And then, if patient reports any discomforts, stop the application immediately. And then, next is after 15 to 20 minutes, or if physician ordered, you can now remove the cold compress. Then inspect the affected area if effective yung cold compress na in-apply natin. Then now remove the towels to the patients. Then position the client in comfortable position. And then evaluate the patient about the procedure. So, ma'am, the procedure is ended. So, how are you feeling today? How was the procedure, ma'am? Do you feel any discomfort or
No. I feel okay.
about the affected area po? Kamusta
Very-
naman po siya?
It's fine.
Okay, okay. So, if do you have any, kung may kailangan po kayo or any question, you just ring the bell so that I will be arriving with you. And then now you will be removing your gloves and perform a hand hygiene. After that, you will document the findings.